Hello guys, in this video we are going to discuss about respiratory failures, the various types of respiratory failure and its management. So let's begin with types of respiratory failures. We have type 1, type 2, type 3 and type 4. Type 1 is also known as hypoxic, in which there is a failure of lungs and heart to provide adequate oxygen to meet metabolic needs. This means the partial pressure of oxygens is less than 60 and partial pressures of carbon dioxide is normal or low. Partial pressure of oxygen means the amount of oxygen which is dissolved in the blood. And we have another is saturation. Saturation means the amount of oxygen which is bound with the hemoglobin. And other is FiO2. This is the fractions of the oxygens which is present in the body. Like if we inhale normal air, there is 21% of the oxygen, so it is 21% FiO2. Type 2 failure is also called hypercapnic because the PaCO2 is more than 45 mm of Hg, but and PaO2 is low. And in case of type 3, there is perioperative atelectasis or collapse. This generally occurs during the general anesthesia. And the type 4 is hypoperfusion of the respiratory muscles in any kind of shock. The type 2 is defined as failure of lungs to eliminate adequate carbon dioxide. If the lungs cannot eliminate adequate carbon dioxide, there will be the carbon dioxide retentions, which results in hypercapnia. So if we see the alveolar arterial oxygen gradient, suppose this is your alveoli, there is the pressures of 100 millimeter of mercury, and this is your arteriole, that is 95, and the gradient becomes 5. In case of type 1, the gradient is increased, but in type 2, the gradient is normal. So let us see some causes of type 1 respiratory failure. It occurs due to alveolar floodings, like in ARDS, severe pneumonia, left heart failure, interstitial lung disease, and asthma. The treatment is high flow oxygens, about 8 to 10 liter by face max we can give. So we can say respiratory failures, hypoxemia less than 60 mm of Hg, and hypercapnia more than 45 or 55 mm of Hg. The alveoli gets destructed there. Let's see some causes of type 2 respiratory failure. The most common is COPD. Second is drug overdose. Other is neuromuscular diseases like myasthenia gravis, poliomyelitis, GBS, Guillain-Barré syndrome. And treatment is low flow oxygens, because if we give high, then there is a risk of CO2, carbon dioxide narcosis, which depresses the respiratory centers. And let's see some of the types of type 2 respiratory failure. We know in type 2 respiratory failure there is increase in PaCO2 more than 45, and there is decrease in the PaO2. So it is classified into acute and chronic. How can you differentiate? We have to see pH and HCO3 bicarbonate. If pH is low, like means acidosis, and bicarbonate is normal, then it is acute. But if pH is low, acidosis, and HCO3 is high, it is acute and chronic. But pH is normal and bicarbonate is high, then it is chronic. So let's see some approach behind the hypoxia or failure. Means if there is PaO2 is less, it might be type 1 or type 2. If the gradient is increased, it is type 1. If the gradient is normal, it is type 2. And if it improves with oxygen supplementations, then it might be due to the BQ mismatch. If not, then it might be due to the shunt. But if there is normal gradient and high PaCO2, so it must be due to the low inspired oxygens or due to the hypoventilations. We have to be sure about this. And that's all. So take home message from today's discussion is differentiating the points like types of acute and chronic type 2 respiratory failures. In acute, there is decrease in pH and normal HCO3. In chronic, there is normal pH and increase in HCO3. In acute on chronic, one is reduced and other is increased. Thank you.